Hi class. So today my presentation is on loneliness in the older adult population and the use of animals as an intervention to help combat loneliness. And so several studies indicate that loneliness can happen for several reasons, such as the loss of a spouse, hospitalization, reduced social relations, or declining health. Loneliness and social isolation are different. Social isolation is a person with limited access to or engagement with the social world, while loneliness is feeling sad and having an unmet need to be in the company of others. And so loneliness can also still happen when being surrounded by people. It's even if somebody's surrounded by a bunch of people, if they have needs that aren't being met, they can still be experiencing loneliness. And the prevalence of loneliness, it's estimated that 1/3 of the elderly population experience loneliness, and that for people age 80 and over 50% of them report frequent feelings of loneliness. And so this is a very big problem, especially because there are serious health-related consequences when loneliness is a factor. And these health-related consequences include depressive symptoms, a cognitive decline, intense feelings of emptiness, abandonment, frequent visits to the doctor, and poor quality of life, as well as an increased risk of committing suicide. And so the intervention that I chose to do my presentation on is human and animal interactions. And it's found that animals can provide a sense of calm, comfort, or safety. And they have a way of diverting the attention away from stressful situations and towards more of pleasure. And the studies are also indicating that developing a bond with an animal can help people develop a better sense of self-worth and trust to help stabilize their emotions, improve their communication, self-regulation, and socialization skills, as well as helping combat feelings of loneliness. And so the animals that are often used in these interventions are dogs, cats, birds, fish, and there are studies that are using interactive robots, such as seals. And these are all providing social support for older adults to meet that unmet need of needing that social interaction. And so there's 3 different types of human and animal interactions. And that is animal-assisted therapy, which is a therapeutic intervention that incorporates animals into the therapeutic plan. And this can be used in individual settings, like such as one-on-one therapy sessions, or in group settings. There's also animal-assisted activities. This is the use of animals in recreational and visitation programs. Oftentimes, these are the animals that you see in hospitals or nursing homes. And then there's also pet ownership. And most people have experienced having a pet in their life. And so owning a pet in the older years of your life helps to bring back memories of a past pet. It helps older adults reminisce and helps alleviate those feelings of loneliness. So pet ownership, studies are showing that older adults are less likely to report feelings of loneliness. And pets also act as a catalyst for human interaction. So older adults who take their dogs on walks or take them to the dog park, they are finding that they are interacting more with other people. This also helps increase the rates of physical activity and helps people feel useful and have a purpose again when they have something that relies on them to keep the older adult has to feed and water in order for the animal to live. So in conclusion, human and animal interventions help to relieve stress and anxiety. It helps to reduce blood pressure, can be emotionally stimulating, helps to promote memories of past experiences, helps to encourage older adults to move and stay active, and has also been shown to reduce difficult behaviors of people living with Alzheimer's and dementia. Thanks for listening to my presentation.